Okay, without further delay, let us start our class. I don't know. Okay, let other people join, and we will see. So in the last class, I think the voice was echoing, so I have to headphone. Okay. I think in the last class we have completed aphorism number 179. So we'll start today from 180. Aphorism number 180. Give the heading useful result of first selection. Useful result of first selection. Okay, as mentioned earlier, in in the case where the medicines were less, we were giving a metaphor of this. This is the case. This is the case, and this is the medicine. Anyone is if any side is uh, lacking, you will be finding a hindrance for your prescription. Okay, so previously it was the medicine which was lacking, knowledge of medicine which was lacking, so we were prescribing on the basis of available medicine. Now it is the knowledge of disease which is lacking. This happens usually in one-sided cases where only a chief symptom is present, only one or two chief symptoms are present which is obscuring rest of the case, or it may happen when the physician is incompetent with the case taking. Okay, case is there but the physician is unable to take the case and take the minute detail. Okay, so that was in aphorism number 175. Hahnemann told that it may be the want of discernment on the part of medical observer. Okay, so that is a different thing. Now it may happen even if you have taken the whole case, you are not getting more than one or two chief complaint, and which is obscuring every other symptom, every other complaint present in the patient. These kind of cases are called one-sided. This one-sided, why this one-sided is happening? Because the vital force is unable to produce or furnish those symptoms. Okay, this is lack of vitality, or vitality is so low that it is unable to produce symptoms and furnish, it is unable to furnish symptoms. Okay, so how to begin in these cases? You are going to begin with whatever available symptoms are there. Okay, but luckily there may be those symptoms which are present, those symptoms may be characteristics. Okay, that has been dealt in 171, that is cure in the first selection. Okay, now this happens only rarely or luckily where one or two symptoms which were present, which were characteristics of a medicine, you gave a medicine and the patient is cured. Okay, so this is not happening in every other case. I have told you this may be due to the expertise of the medical observer, expertise of the physician. I have told you a case of cancer of the head of humerus where the physician prescribed teucrium. Rather, there was no any other symptom than cancer of the head of humerus, and physician prescribed teucrium, and teucrium cured the case. Okay, even the patient outlived his doctor. Doctor died, but the patient was still living. So this may happen. This miraculous cure may happen in some cases where you are getting characteristic symptoms, but this is not happening in every other case. So what is happening in one-sided diseases? One-sided diseases, you have to proceed one after one another. Welcome, Komal. Now, please confirm if you can hear me.
Yes, sir, you are audible.
Can you hear me?
Yes, sir. Good morning,
Okay.
sir.
Good morning. Okay. Just if you have any question, write in the chat box. I will follow. Okay. Now, and you can raise your hand also. So I will follow. Now, uh, next, so we came to just refer to the recordings. Okay, we have talked about at least 5 minutes. It is almost 5 minutes. We are talking about wrapping up the one-sided disease. Means cure in the first selection. If the cure is happening in the first selection, why it is? Just refer to the recording for initial 5 minutes. Then today we will start from 118. Okay, result of useful result of first selection. That was another first selection cure. In the first selection, cure was happening now, but that is not always the case that a cure will happen in the first selection. Why? Because that is only of rare occurrence in one-sided disease when you are finding those symptoms which are actually characteristics. Okay, if you meet the characteristics, you will cure the case. Now 180 useful result of first selection. Now please go on reading. 180, aphorism number 180.
In this case, the medicine which has been chosen as well as possible, but which for the reason above stated is only imperfectly homeopathic, built in its action upon the disease that is only partially analogous to it.
Same thing,
Just
imperfectly
as
homeopathic
in the
or partially analogous. Imperfectly homeopathic or partially. Next.
Just as in the case of mentioned above, in Aphorism 162, where the limited number of homeopathic remedies renders the selection imperfect, produce necessary symptoms, and several phenomena from its own array of symptoms are mixed up with patient's state of health, which are, however, at the same time symptoms of disease itself, although they may have been hitherto never or very rarely perceived.
Underline
Some
this italic one.
symptoms
Okay,
which
underline this italic one, which are, however, at the same time symptoms of disease itself, although they may have been hitherto never or be or very rarely perceived. Okay, so this is the useful result of first selection. You are giving medicine in one-sided cases on the basis of few symptoms. Whatever few symptoms available, you have given medicines. Now this medicine will produce some symptoms. Okay, that symptoms will be, suppose a medicine, listen carefully, suppose a medicine having 1000 symptoms, like Praxvomica having 1300 symptoms. Okay, in the Mathematica Pura, all 1300 symptoms are not going to come. What symptoms are going to come? Which is uh, present or which the patient is susceptible to produce. Okay, so these symptoms are not only the symptoms of medicine, it may be the symptoms of disease also. This is the accessory symptoms of disease. Okay, because the patient was able to produce those symptoms, that is why these medicines are producing those symptoms. Okay, in case of low vitality, low susceptibility, I have told you the patient is unable to furnish the symptoms. Clear? Now you have given a medicine which is arousing the vitality of the patient and you will get symptoms. Clear? Now, in case of carcinosin, okay, carcinosin prescription in the patients of low vitality, those patients, I have told you there are two type of patients of carcinosin. One which have suffered a lot since childhood. Okay, since childhood he is suffering from a lot of diseases, acute diseases. This is one type of where the vitality is not low. But one patient of carcinosin is that which have never suffered any acute diseases. Okay, never having any acute reactions of the body. Okay, this type of carcinosin patient, after you have prescribed carcinosin on the basis of totality, whatever it may be, if your selection is correct, it will produce in the very first few days fever. Okay, there will be a reaction of the body which will be coming as fever. Okay, this fever should be dealt carefully, should not be suppressed. Okay, very listen very carefully. In cases of low susceptibility where you have prescribed carcinosin and patient is having fever, don't jump on prescribing for this fever. Okay, neither paracetamol nor your medicines until or unless it is very acute condition of aphorism number 92. Okay, rather just let your patient to go through this fever. This will result in increased susceptibility of the patient. Okay, number one. Number two, if there is any other chronic medicine producing any other vital reaction in a patient of low susceptibility, okay, that should not be disturbed. In case of carcinosin, it is fever for done. It has been observed by many people, and Forbister have is an authority on carcinosin. He have worked with carcinosin, and he have in his book have remarked that carcinosin in the very first action, if it is producing fever, this is a good indication. Now the same thing can be said for any other chronic diseases, chronic medicines in the patients of low vitality. If the patient is giving any vital reaction, that should not be disturbed. Okay, in case of thuja, okay, I have many times observed, I don't know where I have read this, that thuja will produce purging. Okay, in patients of those patients of one-sided diseases will produce diarrhea, or there will be an increased secretion of sweat, or there will be an increased formation of urine. Okay, these type of vital reaction, diarrhea, increased urination, or any type of fever, okay, this type of vital reaction should not be disturbed in a patient of low susceptibility. Okay, if after your chronic medicine patient is having these symptoms, this should be dealt carefully. Don't jump on prescribing. Okay, wait and watch. Next, many a time you will get there is a hierarchy of Vitholcus health, levels of health, Vitholcus levels of health, 1 2 3 4 5, like that, 12. In the Vitholcus levels of health, there is a hierarchy that at level 12 the patient is not producing any acute disease, but jumping on to level 11 or level 10 or 6 or 7 means jumping of the state, the patient will able to give acute diseases. If after your medicine, if your patient is suffering from acute disease, this many often happen with sulfur. You have prescribed sulfur, and after 2 to 3 days or 1 week, the patient will call you and tell you that, Dr. Babu, I am suffering from coryza, I am suffering from diarrhea, I am suffering from fever. This is also an indication if the patient is suffering from acute disease after your chronic medicine. Okay, this is also a good indication. In this case, if the symptoms are not very troublesome, you can wait and watch. Okay, so these are the signs of rosing vitality. Okay, so here these new symptoms are coming, according to Hahnemann. These new symptoms should be taken care of and again should be prescribed. Okay, so you can prescribe for if these are troublesome. In these cases, especially carcinosin, thuja, sulfur, if these symptoms are troublesome, you are going to prescribe. Otherwise, do not disturb your case. Okay, let the patient give the vital reactions. Okay, next, some symptoms which the patient had never previously experienced appear, or others he had only felt indistinctly become more pronounced. Why the patient was feeling indistinctly? Because the vitality was low. Now your medicine have rose up the vitality, to mark the symptom. Vitality, जैसे बंद कमरे में था, मुंह हाथ सब बंधा हुआ था, ऊ करके चिल्ला रहा है, you are listening from outside, cannot make out whether this is a human being or an animal. Now your medicine, what your medicine have done, your medicine have tied his open up his hand, open up his mouth, and now he is shouting for help. Okay, the vitality have aroused a little bit, and you are going to take help of those symptoms and prescribe. Okay, now 181.
Let it not be objected that the accessory phenomena and new symptoms on the disease that now appeared should be laid to the account of medicament just employed.
Medicine. That is medicine.
They
Medicament is
ought
medicine. Okay. Okay. This
ought
accessory
their
phenomena.
origin
This
to
accessory phenomena. You think? Wait a
certain
minute. You can wait a minute. You can think that this accessory phenomena may be the medicine you have prescribed. Those symptoms are from the medicine, but these symptoms are actually okay. This is of medicine also, because the medicine was able to produce, was having this symptom in the array of symptomatology. Now the patient was also susceptible to those symptoms. That is why these symptoms are coming. Okay, I have told that all the 1300 symptoms are not going to come for nux vomica. Only those symptoms which are the patient which the patient is susceptible to will be produced. Okay, so this accessory phenomena of medicine is actually the accessory phenomena of disease also. First sentence. Next. They owe their origin to it. They owe their
origin to it.
Okay,
Certainly.
this is there is no doubt that these symptoms are due to medicine, but there is a full stop, there is a footnote. We will come to that footnote, small footnote, easy to understand. Now certainly, but read from but.
But they are always only symptoms of such a nature as this disease was itself capable of producing in this organism, and which are summoned forth and induced to make their appearance by the medicine given, owing to its power to cause similar symptoms.
Underline summoned forth. Underline summoned forth.
In a wall, we
Underline.
have to regard
Can you hear
the
me?
whole collection of
Can you hear
symptoms.
me? Underline summoned forth. Summoned
Yes, sir.
forth. Okay,
Yes,
have you
sir.
underlined this? Now, as this disease was itself capable of producing in this organism, underline this also. Now,
Yes,
open Kent's philosophy, chapter homeopathic aggravation. Chapter homeopathic aggravation. Paragraph number 6. Paragraph number 6. Kent's philosophy.
For example, sir.
Yes, from example.
For
Kent's
example,
philosophy,
say
paragraph
you
number
get a
6.
patient that.
Wait a minute. Wait a minute.
Yes, sir.
We are coming from 181, aphorism number 181. We are trying to explain the term summoned forth. We have told that after you are giving a medicine, this medicine will produce symptoms. That is of course due to medicine also, but it is from the patient's own reaction also. Okay, so this may be a phenomena of disease also. Okay, they owe their origin to medicament prescribed. Okay, but there is symptom which the patient was capable of producing. That is why this symptom was coming. Okay, so summoned forth, those symptoms have been summoned forth. Now go to aphorism, paragraph number 6 of Kant's philosophy, homeopathic aggravation. Homeopathic aggravation. For example, read it.
For
Yes, read
example,
it. Ah,
say you get a patient that is destined to go into consumption, a merely suspicious case. You administer the right remedy and a violent reaction comes, foreshadowing of what he will go through years from now if he is not cured by the remedy.
underline this.
A shocking
Foreshadowing.
condition will
Underline
come
this. Foreshadowing.
upon him. He may be
Underline.
frightened
Have you
and
underlined this?
come back
Foreshadowing. Can you
and
hear
tell
me?
you
Can
that
you hear me?
uh,
Komal, can you hear me? Just underline this. Underline this. Foreshadowing of what he will
yes,
go through
sir.
years from now.
Yes, sir.
Okay.
Yes, sir.
Now next. Read next. Read next. Please read next. A shocking condition.
A shocking condition will come upon him. He may be frightened and come back and tell you that uh,
Was an awful dose of medicine.
a shocking condition will come upon him. He may be frightened and come back and tell the you
Awful dose of medicine poison,
tell you
etc.
that an awful dose of medicine, poison, etc. That is the remedy disease. Those poison, etc. That is the remedy. Sir, I am audible.
Yes, you are audible.
Yes, I am audible.
Yes, you are audible.
Hello.
Okay, yes, you are audible. I think I am not audible. Yes, you are audible.
That is the remedy disease. Those are the symptoms of the
Remedy.
that is the remedy disease.
Foreshadowing.
Those are the symptoms of the remedy foreshadowing the future that case because it if if that remedy was not similar enough to get it could not do such thing and it is because of similitude of this of his state and he may only have those symptoms in shadow but the remedy cannot give him symptoms that he has not.
Okay.
It cannot give
give
him
symptom.
symptoms
That is the point.
that
Okay.
are
Underline.
not related to him
Underline this.
except in those
Underline this.
states that
Foreshadowing
are
of the.
that are called oversensitive.
You cannot follow me, Komal. You are not following me. Okay. Wait. Foreshadowing of the future of that case. Underline this. Foreshadowing the future of that case. Underline this. Okay. Next, but the remedy cannot give him symptom that he has not. Underline this. But the remedy cannot give him symptoms that he has not. Okay. So this is summoned forth, and this is the foreshadowing of the sickness. If you are going for an honors in organ examination, the examiner may ask what is the foreshadowing of the sickness. Okay. And what is here summoned forth means those symptoms which were ultimately going to come to the patient by your medicine is coming earlier. Clear? with your medicine is coming earlier. That is summoned forth of the symptom. Okay, or that is the foreshadowing of the sickness. What the patient in the long run finally, here the example of consumption is given. Okay, finally the patient was going to suffer from tuberculosis, but with your medicine that symptoms of tuberculosis came out of the blue, came suddenly and went on suddenly. Okay, in the long run the patient was going to suffer, but what your medicine have done to the patient, your medicine have rose up the vitality, and that symptom which were going to produce very slowly after years duration, that have been produced now only. That is why I have told that if in a patient of low susceptibility, where there is no history of acute disease, after carcinosin, if the patient is suffering from fever, that is a good indication. After thuja, if the patient is suffering from diarrhea, that is a good indication. After any chronic medicine, if the patient is suffering from any acute vital reaction, that is a good indication. Why this is a good indication? Because the vitality have been rose up. Okay, who is producing the symptom? It is the vital force which is going to produce the symptom. Vitality was so low that it was unable to produce the symptom. I have given you example, a metaphor of vital force which is in the closed room. Again and again I have given this metaphor. If you are not able to understand this metaphor, please ask me for the clarification. Again I am giving this metaphor of the vital. Imagine this, a vital force is a person in the closed room. If the vital force is not so low, it will shout for help, it will knock the door, it will make every effort to get attention of the passerby. So vital force will do everything which is able to free him from this. Okay, you are the physician standing outside, but if the vital force is low, tied up mouth, tied up hand, he is not able to furnish those symptoms. Now what happened? Your medicine have just released the tie of his mouth and vital force is shouting. You are able to make sense what vital force is needing. Okay, so this was the case when you are prescribing for one-sided disease. If you are getting these symptoms, these are the example of increased vitality. Okay, this is a good sign, and these symptoms should not be messed upon with. Okay, if the patient is suffering from fever after carcinosin, diarrhea after thuja, or any other acute vital reaction after any other any other chronic medicine, that should not be messed up with until and unless this is so troublesome. Okay, and if the patient is taking any medicine to stop the diarrhea, allopathic, that is very dangerous. If the patient is taking any paracetamol to stop his fever, until analysis is so high, it is not so high, 104 or 105 degrees centigrade, then you can allow in emergency cases. But if he is taking allopathic medicine, so it will spoil the case. And if even if you are giving your medicine, also it may spoil the case. Wait and watch for some time, and this vital give some time vital react to vital force to settle down. Okay, so from where these symptoms are coming, these symptoms are actually was hindered by the low vitality. Now these are coming out. This is the result of your partial homeopathic selection or imperfectly homeopathic selection in one-sided. What is one? Which type of patient are suffering from one-sided disease? Chronic patients suffering from chronic diseases are actually one-sided disease.
Excuse me, sir.
Okay. Yes, you want to tell something?
Yes, sir. Sir, I just want to ask the symptoms that you are telling, like diarrhea after thuja and fever after carcinosin. These are like
Okay.
the summon forth of symptoms that you are telling. This is
You can
due to
tell.
excess of. Is this due to excess of medicine?
No, I have told no. This they owe their origin to medicine. They
Okay.
owe their origin. If the medicine was not having these symptoms won't be produced. Okay, they
Yes,
owe
sir.
their origin to medicine. But
Yes, sir.
okay, read the second sentence. They owe their origin to it certainly, but they are
Sir, actually,
always only okay.
sir, I have joined the class late now, so I just missed that from where this has been studied. I was just
Okay.
listening you, and then I thought.
Okay. Okay. Now you understand. They owe their origin to medicine, but
Hmm.
these are the symptoms which the patient was susceptible to produce, but was unable to produce due to low vitality.
Okay, means even if we give minimum medicine, like minimum dose, and the
Yes.
patient
Yes.
will produce these symptoms.
Yes. Will produce these symptoms.
Okay. So actually,
Okay.
I just prescribed belladonna to one of my patient, and I prescribed him on the basis of like patient. The patient is 8 9 months patient.
Mm-hmm.
He's a child,
Baby.
so he was
Baby.
having high fever, and
Okay.
he was not able to eat or drink something, anything.
Mm-hmm.
So
Mm-hmm.
he lives in my neighborhood only, and they called me, and I was very worried because he's a pediatric patient, and so I just went there and I examined him, and I found that he was not having any stomach ache or earache, and nothing was there. But then I correlated. Then when they said, "Na, his parents said that he's not able to eat or drink anything." So when I told the mother to depress his tongue and saw tonsillitis, and he was
Mm-hmm.
having tonsillitis. So for all the symptoms, on the basis of all the symptoms, I gave him belladonna. And on the same day, he went to other doctors also. He said they said viral fever it is, but I said some coryza or rhinorrhea should be there for viral fever. Then when I gave belladonna for him, he was very better. He like the same day he got better by the evening time. And I what I did is I don't know. Next day also he was getting fever till like 101 102. That day he did
Mm-hmm.
not got any fever. Next day
Mm-hmm.
also I repeated the medicine. PTS belladonna 200 it was.
Mm-hmm.
And after 2 days I told them when that if he was eating well. Now in the second day he was eating well, the fever had not come, and everything was better. So I told them not to give them any not to give further medicine. And the day after tomorrow, like on the third day, the baby developed white papular rashes all over the forehead and on the back. He had
Mm-hmm.
this tendency, like earlier also he had this episode, and the
Mm-hmm.
third day also he developed this symptom. So I got
Mm-hmm.
really scared. It was although the parents told me that this is his old symptom, he had developed this earlier also, but I got
Mm-hmm.
really scared that because of my excess medicine he developed this. Is it so?
Your excess medicine may means if the symptom was present before. Okay,
Huh.
this is the symptom of your patient. Your medicine owe those
Yes, sir.
symptoms owe their origin to your medicine. Even if you
Sir,
were given less
hmm.
doses, those symptoms
Hmm.
may produce.
Would have. Okay.
Okay.
That is, I'm just confused whether it is due to my excess of medicine, or if it is an old symptom, it is a patient symptom of the patient or medicine. Because in when I followed Boric, the same symptom is present in Boric, rashes appearing
Hmm, hmm,
suddenly,
hmm.
and I was
And the
really
patient was susceptible to those rashes. Patient
uh,
was susceptible
might
to
be.
those rashes, and your
Yes.
medicine helped him to produce those rashes. Okay, he
Okay. Might
might
be.
not
Okay.
suffer again those symptoms. If
Okay.
it is the it is your medicine which have helped him to produce those rashes, he might not produce those rashes again in his lifetime.
Okay. Might be. Fingers crossed.
Okay,
Okay.
so
That's
that
why
you can say a summoned forth
hmm.
symptom.
The month of
Okay,
the symptom it will be. Yeah.
okay,
Okay.
foreshadowing of the sickness or summoned forth of the symptom.
Okay. Okay.
Okay,
Thank you so much, sir. Mhm.
okay. Now, so this is 181 we have dealt in a word. Now, go to last sentence. Read the last sentence.
Okay, I'll read.
Okay, read.
In a word, we have to regard the whole collection of symptoms, now perceptible, as belonging to the disease itself, as the actual existing condition, and to direct our further treatment accordingly.
You are not audible.
Okay. In a word, we have to regard. Hello, am I audible now?
Yes, yes, you are audible.
In a word, we have to regard the whole collection of symptoms, now perceptible, as belonging to the disease itself, as the actual existing condition, and to direct are further treatment accordingly.
Okay, so this last sentence is summing up the case of one-sided disease. What is happening after first selection? There may be a cure. When there is a cure, when there is a characteristic symptoms, which those were the characteristic symptoms upon which you have prescribed. Now, usually that not happen. Happened rarely. Now the next is, after first selection you will get some symptoms, array of symptoms. Now you are going to perceive the whole collection of symptoms and proceed accordingly. 182.
Okay. Thus, the imperfect selection of medicament, which was in this case almost inevitable owing to the too limited number of symptoms present, serves to complete the display of symptoms of the disease. And in
Underline
this
this.
way,
Underline this. Imperfect selection. Underline imperfect selection. Underline serves to complete the display of the symptom of disease. Imperfect selection. What imperfect selection is doing? It is serving to complete the display of the symptom of disease. What you need? You need symptoms to prescribe upon. You have stimulated the vitality, and the vitality is able to give symptoms now. So it serves to complete the display of the symptoms of disease. Now, next.
183.
No, same. After comma.
Display of the symptoms of the disease, and in this way facilitates the discovery of a second, more accurately suitable homeopathic medicine.
Facilitate, underline facilitate the discovery of second, more accurately suitable homeopathic medicine. Okay. Underline this. Facilitate. What the first selection have done? First selection have actually helped you to complete the symptom. Next, it is helping you to further select your medicine accordingly. Now here the chart of Gibson Miller is very useful. I have told you before also that you will get this chart after your in the last of your Borix Mathematica, in the last of your Kent's repertory. Nowadays easily available Gibson Miller's chart, where the remedies follows well. Okay, they have given the remedies which are following well, the remedies which are complementary. Previously, before that, one in a sense, last section of BTPB is also helpful, but it is a bit difficult to use. Now, one more book is available in the market, that is Abdur Rahman, Encyclopedia of Remedy Relationship. Okay, if you get it Xerox, if you can get this book, it is very helpful in clinic. First, refer to Gibson Miller. If you are not getting there any complementary or remedies follows well relation, it is better to follow that Encyclopedia of Remedy Relation by Abdur Rahman. Okay, that is very useful book, and each and every relationship have been means quoted with a reference of authority. So it is very trustful book. You can trust on it, and it is very useful for your practice too. In one-sided cases, usually these days, what is happening? Most of the cases we are getting in the clinic, in those who are newly setting up their clinic, a new doctor in the locality, the patient will not open up to them and will not give many symptoms. The case is 175. What was there? Lack of want of discernment on the part of medical observer. Okay, this thing may happen. 175. Next, it may happen due to one-sided disease. Nowadays, why we are having lots of one-sided disease? Because of over medication. Okay, because of over medication of the population, patient's susceptibility is getting low and low. Overuse of antibiotic, overuse of paracetamol, overuse of anti-allergic, overuse of many allopathic medicines, includes that Pandy. Okay, be it paracetamol, be it anti-allergies, these are suppressing the symptoms, suppressing the vitalities. Okay, that is why we are getting lots of one-sided diseases in society nowadays. So we have to proceed accordingly in zigzag fashion. After this medicine, this is helpful. After this is helpful. In case I have shared in the group was that of ignitia. I have prescribed ignitia. After ignitia followed by causticum, two medicines were needed, but there was no particular symptoms of ignitia. Yes, that was a case of acute renal failure. There was no particular symptoms of ignitia except those grief and that deep sighing which I have observed. You might not observe in your clinic the deep sighing of your patient if you have not trained your eyes. Okay, so I have observed the deep sigh and a history of grief followed by acute renal failure, but ignitia was not enough to cure the case. Causticum was needed. So this followed by, okay, to me ignitia may be a perfect selection, but it was imperfectly chosen because there was no other symptom of ignitia was present. Okay, we don't know that ignitia is producing ARF or not. We don't know ignitia is producing these kind of symptoms, but I have only 1 to 2 symptoms, one in history, one in observation, physician observation. Chief complaint, no hint of ignitia. Generalities, no hint of ignitia. One is history, one is physician's observation, and I was prescribing on the basis of this ignitia, followed by then after ignitia some symptoms of, you will see that cramp of the calf muscles. After ignitia, following same grief pattern, causticum was prescribed, and the patient's creatinine from 8.8 came down to 1.73 within 2-3 months. Okay, 2-3 weeks like that. So this was a case of, means one after another selection of which facilitate your selection, next selection. And to help this, you can take help of Gibson Miller chart. You can take help of the last section of the BTBB, which is difficult to use. We may, if we may get some time at the end of our classes, we will sometime discover the treasures of BTPB. Okay, BTPB are often useful, but it is tiresome and taking times. And you can take help of Abdur Rahman's Encyclopedia of Remedy Relationship. It is very useful book. Now 183.
Whenever, therefore, the dose of the first medicine causes to have a beneficial effect, if the newly developed symptoms do not, by gravity, demand more speedy aid, which, however, from the minuteness of the dose of homeopathic medicine and in very chronic disease, is excessively rare.
Okay, this is what I have told you. This is what I have told you. If the patient is suffering from fever, until unless it is very acute, don't go on, jump on prescribing the medicine. Okay, so until unless it is not needing any help, you should not prescribe for that. Now,
a new examination of the disease must be instituted. The status morbi, as it now is, must be noted down, and a second homeopathic remedy selected in accordance with it, which shall exactly suit the present state, and one which shall be all the more appropriate can then be found, as the group of symptoms has become larger and more complete.
okay, this is the case. Now read the footnote. It is very important footnote from the viewpoint of your MCQ also, that Hahnemann is mentioning about a dose of opium in those cases of low vitality. Okay, and from the point of view of practice also. This is many a time it has been asked in MCQ examination, that where in which aphorism or which footnote Hahnemann have told to use a dose of opium. Now read it.
In case where the patient, which however happens excessively seldom in chronic but not frequently in acute disease, feels very ill, although his symptoms are very indistinct, so that this state may be attributed more to the benumbed state of the nerves, which
Underline this.
does not
Underline this. Feels very ill. Feels very ill. But symptoms are very indistinct. Feels very ill. Symptoms are very indistinct. Okay. Opium. Allen's keynote. All complaints with great soper. Painless, complain of nothing, wants of nothing. Fourth paragraph. Second paragraph, want of susceptibility to remedies, lack of vital reaction. The well-chosen remedy makes no impression. Want of susceptibility to remedies. In bracket, you will get Carbovage, Laurentius, and Valeriana. So what is this? Hahnemann is telling this happens seldom in chronic cases, but more acutely in acute cases. But in our observation, we have seen that in chronic cases also, if there is less and less symptoms, that we can attribute to the state of low vitality, and by our medicine we are going to arouse the vitality. Again, refer to same metaphor. The vital force is a person, tied up hand, tied up mouth inside a chamber and asking for help. Now your medicine have opened up his mouth and he can shout and specifically want help, what he need actually. So where Hahnemann is telling, it is happening in acute cases, but it is also happened in chronic cases, like the carcinosin we have discussed. The carcinosin we have discussed, that the patient, two type of carcinosin are there. One carcinosin patient who has suffered a lot of acute diseases since his childhood. That is not the case of low vitality. But one patient who have not suffered any disease, even there was no fever since childhood, that is a want of low vitality. There is a low vitality, want of susceptibility. Here if you gave carcinosin and it has aroused the vitality, there will be a fever. Okay, same, feels very ill although his symptoms are very indistinct. Okay, and underline this, may be attributed to benumb state of nerve. Underline this, benumb state of nerve. What does this mean? That is low vitality. Low vitality. Next.
Which does not permit the patient's pain and sufferings to be distinctly perceived. This stopper of the internal sensibility is removed by opium. And
Underline
in
this,
secondary action,
is removed by
and in
opium.
its
Hahnemann is advising opium for these cases. You can use opium also in that fashion, but I have not used this till now. Those chronic medicines are enough to arouse the vitality. Next.
and in its secondary action, the symptom of the disease become distinctly apparent.
Symptoms of disease becomes, why the symptoms of disease becomes distinctly available? Because of the rose vitality which can furnish the symptom. Which is producing symptom? Vital force is producing symptoms. Clear?
Yes, sir.
Okay, so regarding opium, in your MCQ, from viewpoint of your MCQ, just mark that where the opium was again causing, mentioned by Hahnemann. Opium is mentioned by Hahnemann in aphorism number, I think, where it is mentioned by intermittent cases. No, in intermittent cases, this aphorism number 236 footnote, that is important for those who will go for MCQs. Okay, again a mention of opium is there, aphorism number 236 footnote. We will see what is there, but just mark it. Okay, right here again a mention in here only 183 footnote, again a mention of opium is there in 236 footnote. 236 footnote, right in the margin. Okay, that is a different, totally different thing, but you should know. Next, 184. Now 184, conduction of cure in, how give the heading, conduction of cure of one-sided disease, OSD. Conduction of cure. Conduction of cure. Now read it.
In like manner, after each new dose of medicine has exhausted its action, when it is no longer suitable and helpful, in sixth edition, the state of disease that still remains is to be noted anew with respect to its remaining symptoms, and another homeopathic remedy sought for as suitable as possible for the group of symptoms now observed, and so on until the recovery is complete.
Okay, this is actually the conduction of cure. This is actually mostly happen in our clinic, because mostly nowadays we are having cases which are one-sided disease, or which are not actually one-sided, but patient is not opening up to a new physician. Okay, now why these one-sided disease are more? I have told you that over medication, over use of synthetic products, over use of fertilizers, chemicals, because the organisms have become complex. Introduction, first paragraph. Go to introduction, first paragraph.
Yes, sir.
Read it.
As long as men have existed, they have been liable, individually or collectively, to diseases from physical or moral causes. In a rude state of nature, but few remedial agents were required. As a simple
Hahnemann is
mode of
talking
living,
200 years ago, and he is telling the organism is getting complex 200 years ago. Now think of our times, how complex the organism may be. Okay, read it.
the remedial agents required as a simple mode of living admitted of but few diseases, with the civilization of mankind in the state. On the contrary, the occasions of disease and the necessity for medical aid increased in equal proportion. But ever since that time, soon after Hippocrates, therefore, for 2500 years, men have occupied themselves with the treatment of ever increasing multiplicity of diseases, who
Okay,
led as soon to the
ever
vanity.
increasing multiplicity of diseases. Now every now and then you will hear this is a new disease, every now and then you will hear this is a new disease discovered, new disease discovered. Where from these are actually coming? These are actually cropping up from our complex mode of living, overuse of medicines, okay, overuse of chemicals, fertilizers. Because of this, organisms is rendering very complex. Okay, that is why nowadays we are having lots of one-sided diseases. Okay, complexed with, and there are also artificial diseases complexed with chronic diseases complex among themselves, plus add on artificial diseases. So these are the difficult cases we are facing in our clinic. Okay, so one-sided diseases finishes up here 184. From 185 onward, there is a concept of local disease started.
Local.
186 we have at some point of time we have dealt with 186 in detail. So we will skip that 186. Follow the older lectures. I think it is in third or fourth lectures of beginning of this course. In third or fourth lecture, we have dealt 186 in detail from viewpoint of when we were dealing with introduction or preface somewhere. So 186 we will skip. It is about surgical disease and homeopathy. 185 onward, there is allopathic view of local disease, and local disease, then external application. Okay, we will deal it from next class onward. Any question you are having, you can ask.
So that foreshadowing and summon forth was in which chapter of class?
With aphorism, it was 181, summoned forth 181. And Kent's philosophy, homeopathic aggravation, chapter homeopathic aggravation,
Okay.
para number 5, I think 1, 2, 3, 4, 5, 6. Para number 6.
Okay, sir.
Okay, Komal, you want to ask anything? Okay. Okay. Thank you. Thank you for giving me your attention for 1 hour. We will meet on next Sunday. Okay, I hope there is no disturbance of network today, because in the last class we are facing a lot of disturbance. So I decided to take class from this place. Okay. Thank you.
Okay, sir. Thank you, sir.
Thank you.